Hey everyone, welcome back to the channel. So today I wanted to talk about pars stress fractures. We had a massive run of these in the clinic the other month where we had maybe 8 to 10 in the space of 2 weeks. It was a real flood. So I guess for those of you who don't know what a pars stress fracture is, it is a stress fracture of the pars interarticularis in the spine. So it's a bit of the bone that joins sort of the front and the back of the spine. It's really, really common in sort of ages 13 to 18. We know that in cricket fast bowlers, the rate of these goes down 3 to 400% after the age of 23. So it's definitely an issue of the young. And this is because the bones in the spine are not fully formed until about age 23, 24. And so the bone represents the easiest weak point for things to break down. So I guess what do these look like? They can have some varying grades. They can often look like nothing at all. So we easily had two or three who we were seeing patients for something else, like a sore knee or a sore ankle. And they mentioned, oh, my back's been pretty stiff the last couple of weeks. And you have a chat to them. And, after 10, 15 minutes of running, their back gets quite sore and often stops them running. And then the next day they can wake up feeling really, really stiff in the back, which for a adolescent is quite unusual. For us older people, waking up with a stiff back is quite normal, but for young people, that is not normal. I guess in the clinic, typically they'll have pain to run and jump or hop. And when we put them into an extension and a rotation position, that really loads the pars area, and this is often replicating of their pain. So people can look really, really good. They're going to school, they're walking around, they're playing their sport relatively okay, but just with a bit of pain at the end of the game and stiffness in the next morning, and it can really, really sneak up on you. I think one of the big causes for this we find is growth. So as you grow and you get taller, that leaves your bone to stretch. But in that time where it stretches, it's relatively low density, so it will have weak points, such as the pars, that make it more susceptible to injury. So one of the biggest causes for this is high vertical growth. So we know kids that grow more than 1 centimeter a month a much, much higher rate of injury. And so during those peak growth phases, we do recommend to parents to reduce the kids' training amount by about 20%. And that can be either just dropping one training session, or it can be, like 15 minutes off 4 training sessions. Just, it doesn't sound like a lot, but it can have an enormous impact in their health. So I guess, what causes these is, like I said, a lot of growth. So the bone is always breaking. So if you go on a run, you break little bits of bone, like tiny, tiny, tiny. You go home, you go to bed, you rebuild bits of bone. And that ratio is normally pretty balanced. These stress fractures are when that ratio is unbalanced. So you're breaking it faster than you can build it. Now that might mean you're training a lot. Your training has gone up, you've been selected in a rep team, you've got a few extra games, or your school soccer team makes it deep into Bill Turner Cup, so you've had a few extra games during the week. Or that your bone isn't healing very well, and this can be because of like low calcium intake, so low dairy, not enough yogurt or milk, or low energy availability, so you're just not getting enough energy in the day to cope with how much the child is growing or how much they're exercising. And lots of this is super unintentional. Like, kids just don't always eat as much as what they think they should need, and they might not like yogurt, and that's just sort of where it ends up. And it's a really innocent mistake that can be easily fixed with some guidance from us and the dietitian team. So I guess, how is it diagnosed? In the clinic, probably subjective history, so what you tell us is happening, and then those objective tests I mentioned earlier. But an MRI is the gold standard. An X-ray will struggle to identify this, and it will often identify it about 4 to 6 weeks too late, whereas an MRI can diagnose it quite early and very effectively. A CT scan in the early stages can also miss this. So MRI is definitely the gold standard, and we normally send our patients for that. I guess as a physio setting for the MRI, we cost the same as the GP for this, so we don't often refer back to the GP for that process to be cheaper. Rehab. So I guess depending on the grade, we can go into a lot of detail about that, but you can have small grades, medium grades, larger grades. Small grades, you're probably going to need anywhere between 2 to 6 weeks of relative rest. The larger grades can be more like 6 to 12 weeks of rest, because you really, really need to let that bone heal. It is very, very important, because if it doesn't heal, then you can end up with the bone sort of not fully fusing, and then that can result in longer term loss of stability in the spine, and you can generate something else that can go on to need surgery later in life, which obviously everyone would like to avoid. So letting it heal is paramount. So we prescribe aggressive rest to stop all those aggravating activities to give the bone the best chance to heal. And then from a rehab point of view, it's not a very complicated rehab. We look at maximizing hamstring length and improving core strength. So after a couple of weeks, we'll get people doing some abdominal work and some stretching. And then we just give people a slow greater progression back to their sport. So if it's cricket, we'll start you running, and then we'll give you 1 over, every couple of days, then 3 overs every couple of days, and then 5 overs every couple of days, just to sort of help build up that load. Soccer will let you go back to half an hour of training, then 45 minutes of training, and progress that depending on the individual's previous fitness and the type of injury. So that's the sort of rehab in a nutshell. So thanks for listening, guys. It's a pretty interesting topic, past stress fractures. It's something we see a lot of. It's something I enjoy treating and helping rehab. It can be confusing and quite, it can really sneak up on people, and it can feel like they don't really deserve it. And that's definitely the trend. But it needs to be something that is really seriously managed, because failure to manage it can result in long-term outcomes that are not desirable. So if you've got any questions, just shoot me a message or give us a like and a follow, and help share this video with someone who you think might need to see it. Have a good day.